I'm Margaret, and this is a summary of a small research project I did for my final course in my Master's of Public Relations program at Mount St. Vincent University in June 2018. One of the most important issues today in British Columbia and in Canada is the drug overdose crisis. The drug-related death rate in BC in 2018 is 30 deaths per 100,000 people. That is 6 times the 2006 rate, in high contrast to other attributed death rates such as motor vehicle accidents, which has dropped from 10 to 6.4 in the same time period, and heart disease, which has dropped from 203 to 131. We expect death rates to decrease with medical and safety advances, but the overdose rate is increasing. One of the linkages found in this crisis is that people who use drugs alone are at higher risk of overdose death because no one is around to summon emergency response and save their life. Some of the reasons people use drugs alone include the illegal nature of the substances used, the desire that others don't know about the drug use, emotional disconnectedness, and stigma and shame surrounding drug use in BC. In response to this crisis, the BC government declared a public health emergency in 2016, enhanced harm reduction and legal support services, and has undertaken 2 public information marketing campaigns, encouraging the public to be informed, not use drugs alone, and in 2018 to show compassion and have supportive conversations. Reliable analysis is lacking around the public opinion expressed in the comments on BC government overdose-related social media posts. This project provides a preliminary analysis and potential methods for future exploration of such comments. I explored several research questions in this project. The main question is, what are the recurring themes in the public opinion expressed in comments on the social media posts by the BC government about overdose prevention on Facebook and Twitter? Other questions are, what keywords appear in comments and how often? What is the tone of the comments? What framing is evoked in the comments? Are the comments positive, negative, or neutral? Do the comments indicate audience members will undertake recommended actions? Literature was reviewed on stigma related to drug use and people who use drugs, health communication theory and health behavior change, a review of campaigns around overdose and drug use, research theories, public opinion theory, and social media studies. The project looked at 25 organic posts made by the BC government social accounts between January 1st and May 24th, 2018. There were a total of 139 comments on these posts. Each comment was analyzed by looking at keywords, tone, framing, sentiment, and behavior indicators. Of the 25 posts, 22 were announcements of a new program, spending, or campaign. One was an announcement with a personal story from a person who uses drugs. One was purely the text from the marketing campaign. One was a retweet of a sincere comment from Minister Darcy. There were 0 comments back from the BC government account to the 139 comments. The most shared post had 45 shares, 206 hearts, and 9 comments. That post tagged several well-followed accounts, including the Vancouver Canucks hockey team, a partner in the campaign. The post with the most comments was retweeting Minister Darcy's quote made on March the 6th, with 82 hearts and 33 retweets. This post was an example of social media best practice. Heartfelt, consistent hashtags and a link to the website. The only thing that would have made it better would have been to tag popular partner accounts. I looked at keywords in the comments and sorted them into categories, created by findings in the keywords. Factual words were found 119 times. Words like addiction, pharma, pharmaceutical, opioid, drug, OD, and treatment. Words associated with sadness, gloom, and negativity, such as death, pain, die, kill, problem, and crisis, were mentioned 39 times. Words associated with stigma and judgment were found 35 times. These were words like addict, stigma, marginalized, and punish. There were 30 mentions of words associated with hope, like recovery, families, concern, and awareness. There were 29 mentions of words associated with government and law, such as decriminalize, legal, taxpayer, and government. The three middle methods of analysis were framing, tone, and sentiment. The first, framing, is found by thinking about the selected perception and emphasis. What did the writer intend to convey? There was a surprising number of commenters who were trying to turn the conversation to their own priority issues, such as alcohol addiction, Site C dam, political criticism, or their own legal issue, 21% of the total. Another 20% of the comments were framed in, well, nothing. They were just nonsense or a joke back to another commenter or asking for clarity. 18% of the comments indicated support. There were many single topics, but addiction treatment occurred the most often at 10%. 7% were critical or showed lack of sympathy, such as let them die. The rest of the framing was about a specific topic around the overdose crisis, such as drug supply, pharmaceutical industry, decriminalization, or pain medication. In the tone analysis, I looked at each comment for the emotional tone and intended impact of the words. Again, I saw that hijacking the conversation took a large chunk of the categorization at 24%. Support and positive comments added up to 24%. Critical tone about anything was 30% of the comments, and disapproval of the post was 5%. The tone of 17% of the comments was taking the issue very seriously. Sentiment can be described as positive, negative, or neutral, but I also found strong overtones of judgment in the comments, not always regarding overdose, sometimes about other commenters. The look at sentiment had nearly 20% of the comments categorized as factual or neutral. 22% were hopeful, more than half were judging, and 8% were hopeless. These three methods of analysis can be seen as generally overall fitting into themes of factual, hopeful and supportive, judging or critical, unrelated or didn't make sense, hijacking the conversation, or hopeless. The final way of analyzing the comments looked at the indication that the requested behavior to show compassion and have supportive conversations would be taken. The behavior changes encouraged in BC government's overdose prevention campaign can be described in the health belief model as commenters believing they or their loved ones are at risk, understanding costs and benefits of showing compassion and having the supportive conversations, heeding the cues to action, and feeling confident they can do the behavior. Looking at the data through this lens resulted in 4 categories. Likely to take different action meant the commenter showed they had interest in an entirely different topic. Yes, likely to take the requested action was where the author indicated an interest or an openness to taking the requested steps. NA was a category where the comment indicated nothing or was nonsense. Opposite action meant the commenter showed resistance, seemed hostile or critical, or they were not interested in taking the requested action. Behavior indicators analysis felt very intuitive and dependent on my experiences and biases. It was a bit of a stretch to imagine, based on the words in a social media post, to know if the author was likely to take one action or another. However, in one of the categories, yes, likely to take the requested action, the commenters were very likely to take the action as they were adamantly helpful or supportive. The content analysis found through framing, tone, and sentiment was generally consistent within the 3 methods of looking at the data, but the behavior indicators analysis yielded something different. My light bulb moment and conclusions were that in health communication content analysis, looking at framing, tone, and sentiment plus a behavior theory lens equals richer findings. So in future research, there is much, much more to be done. From looking at the paid ads run by the organization on this topic to exploring the use of health behavior theory in other content analysis to looking closer at the posts by this organization in this time period, there is still considerable research work to be investigated. Facts around overdose in BC indicate that there is an average of 4 deaths per day. This alone should raise this issue to the high. Facts around overdose in BC include that there are an average of 4 deaths per day. This alone should raise this issue to the highest priority. Staffing shortages understood. What price are we putting on 4 human lives per day? An observation of 5 months' worth of social media posts is that the habits in place at that time could use some improvement. Some of the items missing include consistent tagging of key partners' accounts, sharing partner posts, using consistent campaign hashtags, engaging with commenters, using a variety of visuals, and the use of a well-planned editorial calendar to mix up the content. This topic includes more than just announcements. A government account should understand and promote destigmatizing and respectful language. There are several sources for this, and consistent guidelines for posting should be followed. Best practices in social media work include a focus on a call to action or behavior, which can be measured either through clicks, downloads, views, or concrete action in communities. Lastly, there is much to be gained through partner outreach and cooperation, including support, idea sharing, and tapping into followers from other organizations. By working together with an all-of-society approach, each sector that is connected to this crisis can help our province find its way out of this terrible loss of fellow human beings.